Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Welcome back, everybody, to another episode of Explain This. I'm with the star of the show, Robin Riddle. Robin, over in West Knoxville today. How are you?
I'm doing great. How are you?
I am wonderful. I'm in North Knoxville, and I have a feeling we're both freezing.
Absolutely.
But nothing warms my heart more than getting to do this with you. So thank you for doing this with me today.
Absolutely.
Today's topic is one that it comes up a lot on the Q&A show. I know it comes up a lot in office for you. PPIs, proton pump inhibitors.
Correct. You
Look
got
at,
it.
Look at that. First of all, explain that to me like I'm a 10-year-old. What are they? Why does somebody get on them?
Okay. So proton pump inhibitors are a group of medications that were developed to help reduce stomach acid and relieve symptoms of GERD, or gastroesophageal reflux disease. Common brand names of PPIs are like Nexium, Prevacid, Prilosec is probably the most common one that I see people on. So like I said, PPIs are used for treating GERD. We do use them in conjunction with antibiotics for treating a stomach infection called H. pylori. People get put on these for stomach ulcers, Barrett's esophagus, different things like that that are related to stomach acid overproduction.
Interesting. So is it like, what sort of, if I have a stomach ache, or is that when I would go on a PPI?
It's usually more prescribed when people come in and say, like, every time I lay down in bed, I have like this burning sensation that's going up my throat. Lots of that reflux type symptoms, burning in the chest, some chest pain, even a little like chronic like cough clearing sort of thing can be a sign of reflux. And so this is when people often get put on a PPI. And so they work because they stop the proton pump from completing the chemical process needed to make stomach acid. Hence the name, proton pump inhibitors, stops it from working.
Okay.
It doesn't block all stomach acid, but typically within about 5 days of starting a PPI, it reduces the stomach acid production by about 65%. So significant reduction in stomach acid.
No, I was going to ask, like, so people do need it, theoretically.
Yeah. I mean, there are definitely situations where a PPI is needed.
Okay.
They do serve an important purpose, but PPIs are chronically overused, which then can result in a lot of negative side effects. So our body knows that we need stomach acid. It's producing it for a reason. So sometimes that significant reduction in stomach acid production caused by the PPIs can lead to some unwanted side effects. Number one thing that I see out of these is increased risk for GI microbiome imbalances and bacterial overgrowths. You know, I do all kinds of gut health stuff.
Yeah.
So stomach acid helps to kill off bad bacteria and keeps the microbiome in balance. So when we remove up to 65% of that stomach acid, the bad bacteria can grow a lot easier. So I specifically see this linked to higher rates of C. diff and SIBO, small intestinal bacterial overgrowth. All the time. I see SIBO all the time with these medicines.
So patients, because I know you see a lot of SIBO in office, and what I'm hearing is that they have SIBO and they're also on a PPI, which might have caused it,
which might have caused it.
Okay.
And so if I'm treating someone with SIBO, I can't really fully get rid of their SIBO unless we get the PPI out of the situation, because it's complicating that whole process.
Okay.
So PPIs are also known to increase the risk for lower bone mineral density and increases the risk for fractures because it makes it harder for the body to reabsorb calcium. So of course you need to be thinking about this with your older population. They're going to be at a much higher risk if you put them on a PPI.
Much higher risk for like osteoporosis,
osteopenia, osteoporosis. Yeah.
Okay.
Yeah.
Okay.
There is an increased risk for developing or worsening chronic kidney disease, risk of magnesium and B12 deficiency, because again, it changes absorption of vitamins. There's even a risk of dementia linked with these medicines. And weirdly enough, I saw this multiple places, increased susceptibility to pneumonia.
Oh, no.
So risks increase with the length of time that you take the PPI. So these medications were originally researched and developed for short-term use only, supposed to be used for a course of about 6 to 8 weeks to decrease symptoms and then come off of it. And should only be continued in like very specific high-risk situations. But that's often not what happens. People go into their primary, complain of a little bit of heartburn. Instead of having a conversation about their diet or their weight or other factors that could be contributing, the conversation is, here's some medicine, take it. If you need more, take more. They don't talk about any of these risks. I mean, I'm sure if they told you, hey, I can put you on this medicine that's going to help your heartburn instead of changing your diet, but you could develop dementia and osteoporosis and pneumonia and kidney disease, I'm sure not everybody would be like, sign me up. And that's one of the things that I'm so passionate about is educating people, educating your patients so they know what they're getting into. You cannot consent to something if you don't know what your risks are. And if people tell you, there's no side effects, there's no risks, that's not true at all.
No, I love that, Robin. And you talk a lot about that with fertility as well as with gut health, just everything.
Yeah.
We're trying to educate people so they know like what they're getting into and so that they can make the best possible decision for themselves.
Yeah.
Is there a scenario where somebody would want to be on this long term, or is this kind of cut and dry, like you don't need to be on this long term? This is a quick fix.
So like Barrett's esophagus is one of those situations where a PPI might be needed long term because the risks that can come with Barrett's esophagus, as far as like the breakdown of the esophageal tissue, increased risks for ulcers, cancers, things like that. That's a situation where if we can't control this naturally or can't control it through diet, then a PPI would be worth the risk. But if it's one of these like, I don't eat great and I have heartburn all the time, so this fixes it, that's not the kind of situation where we want to be chronically using this.
Okay.
Because there's better options. So diet changes are number one. If it's food triggers, avoid the foods. If you're eating greasy, fatty, fried foods, fast foods, eating on the go all the time, your spicy foods, your highly acidic foods, all of that can increase the risk for reflux. Eating too much at one time, traditional American servings. You go out to eat, you get enough that would feed like 3 people in any other country. So when you sit down with a plate of food like that and you eat all of it, now your stomach's so full that we're putting a lot of pressure, which increases the risk for reflux. So, eat smaller portions, avoid the foods that are your triggers. For some people, just that is enough to control symptoms. Weight is another big one. So increased abdominal obesity puts more pressure on the stomach. We can even have like hiatal hernias, things like that starting. That increases the possibility of reflux. Okay. Drinking apple cider vinegar, about a teaspoon of raw, unfiltered apple cider vinegar diluted in some water every day can help to reduce symptoms. So sometimes people will have symptoms of reflux that they think is too much stomach acid, but it can also be too little stomach acid. So hyperchloridia and hypochloridia both present very similarly. So one of the ways that we can tell is take a shot of apple cider vinegar. For people who truly have way too much stomach acid and we need to reduce it, it's going to increase the heartburn. But if it's an issue of the balance of stomach acid to bacteria and all of that, apple cider vinegar can actually be super helpful in reducing symptoms.
That's really interesting how the opposite things can present with the same symptom.
Yeah.
And then, if you don't like ask these types of questions, you could get on a PPI. And in fact, you needed the opposite. You needed more stomach acid or something along those lines.
Yeah. So I always doing a little bit of digging is
Yeah.
really beneficial.
Yeah.
Probiotics are always helpful to balance out stomach acid, stomach bacteria, all of that. Aloe vera juice is really helpful. So if we're having some symptoms of reflux, drinking some aloe vera juice helps to line the stomach and decreases those symptoms. Weirdly enough, eating bananas can help with heartburn.
That has to be the most random one of the day.
I know, right? Drinking baking soda. I think Dr. Rogers has actually talked about this before, but a small amount of baking soda mixed in with water can provide some temporary relief of symptoms. One of my favorite supplements, this is what I take for any kind of heartburn symptoms, is slippery elm. And I take it in lozenge form, which means it's a little, instead of a pill that you swallow, it's something that you kind of suck on for a few minutes. And as it breaks down, it coats and lines the esophagus and the stomach and reduces any kind of reflux.
Interesting. So that's a lozenge?
A lozenge. Yeah, slippery elm.
Okay.
DGL, don't judge me on my butchered pronunciation, but it's diglycerinated licorice. It's hard. So I call it DGL. DGL is a supplement that increases the production of a protective mucus in the digestive system. So we take DGL and it acts as a protective barrier. It also helps to heal any damage that's been done. So if you've had long-term heartburn, DGL actually can heal damage. Decreases reflux. It's something that we use really commonly to treat H. pylori, which is a stomach bacteria that tends to be linked with reflux. Marshmallow root. So you gotta love Instagram. My husband loves to doom scroll on Instagram. And he found this video the other day of healthy marshmallows. And he's like, I want you to make these for me. And it's made with marshmallow root. So you can actually make marshmallows with marshmallow root and beef gelatin and a couple of other things. And it is healing for your gut.
That sounds incredible.
Yeah.
Like, I love everything about
that. Goes. I have some marshmallow root tea steeping in my kitchen right now, getting ready to make some homemade healing marshmallows. So we'll see how it goes.
Healing marshmallows.
Yeah. One of the things that I find really interesting about controlling reflux is that we can actually help by controlling histamine levels. So histamine is released when foods enter the stomach, which causes the production of stomach acid to digest those foods. But for some people, this can lead to reflux symptoms due to an intolerance to that histamine.
Interesting.
So if you tend to get headaches along with your heartburn, that's a big sign of a histamine intolerance. So following a lower histamine diet can be helpful. Natural antihistamines, so quercetin, vitamin C, bromelain, things like that. But one of the big things I like to use for this is actually DAO enzymes. So again, if you get headaches with your heartburn, if you have chronic allergies, if you have any kind of food reactions, skin reactions, digestive issues, anything like that, DAO, which stands for diamine oxidase, DAO enzymes break down the histamine that is being produced in the gut and can really reduce symptoms significantly.
That is interesting.
I know, right?
Would you have to, in order to find that out, would you have to check a histamine level? Or
you can. It's really hard to get a good reading on a histamine level because we have to check it when you've done something to trigger it.
Okay.
So you'd have to like eat a high histamine meal and then get your levels checked right afterwards.
Okay.
So typically if we have any of those symptoms, I just recommend we try out some DAO enzymes and see if it helps.
Got it. Okay. And you find out that you kind of find out afterwards. Oh, it was a histamine. Okay.
Yeah. Of course, there's your over-the-counter options like Tums or your H2 blockers like Pepcid that are used only as needed. That's still a better option than being on a chronic PPI every single day.
And, you know, this is explain this, Robin, and I reserve the right to ask dumb questions.
Go for it.
So a PPI is a prescription.
PPI, well, actually, you can get it over the counter now.
No kidding.
I don't like.
Wow.
Because then people just put themselves on it. A lot of times it is done as a prescription, but no, you can actually get it over the counter now too.
Interesting. Okay, because I was thinking, okay, the Tums and the Pepcid options are the OTC options, but those are just kind of. I was going to ask you what you thought of Tums, because that is like a quick go-to if you have a little bit of heartburn.
Yeah, I mean, chronically using Tums is definitely not my favorite, but if it's an every now and then sort of thing, it's okay.
Yeah.
But yeah, you can go and get like omeprazole over the counter now.
Okay.
Which, again, I don't agree with, because then people just put themselves on it and they're like, oh, I feel better. And then they really don't have a risk versus benefit conversation because they're not even getting it from a provider.
Right. I'm with you.
So if you're one of those people that has been on a PPI for years and years and you're interested in trying to stop it, there is a process to this. I never recommend just cold turkey stopping a PPI, especially the longer that you've been on it, the more likely you are to have some rebound reflux. Now, if you want to stop at cold turkey and suffer through and use some of the over-counter stuff, you can. But typically, if you've been on it longer than the recommended 8 weeks, I do recommend some sort of taper. So you can do a slow taper where you just decrease your dose by about half every 2 to 3 weeks until you've completely discontinued it. You can alternate dosing, so you can like decrease using your PPI by taking it one day and then taking an H2 blocker like the over-the-counter Prevacid on alternate days, and then just slowly decrease the number of days that you're taking each of those. You can stop the PPI and switch directly to an H2 blocker, which again is the over-the-counter Pepcid. And then just slowly decrease the use of the H2 blocker over several weeks as well. And then, of course, adding in some of the supplements that we talked about to help with those breakthrough symptoms. So start some DGL, drink some aloe juice every day, things like that that give that barrier in the gut as well.
How long, like say I want to taper off, am I looking at like a 6-month process, or...
Depends on how long you've been on it and how significant your symptoms are. So I have some people that I've tried to get them off of it over a 3 to 4 week time span, and they just rebound too bad. And so then you've got to bump it back up and really start slowly working down again.
Got it. And by rebound, it just is unbearable. Like just the symptom is
just significant, like can't lean forward, can't bend over, so much reflux, it hurts to lay down. So sometimes we got to take it really, really slow.
Super, super interesting. And what we'll do, Robin, is we've done episodes on H. pylori as well as SIBO. We'll link those in the comments below. Anything else you want to end with, Robin, before we call it a podcast?
I think that's it.
All right. Well, guys, thank y'all so much for hanging out with us. Robin, thank you for explaining PPIs to me and us over on YouTube and Spotify and Apple and all the places. We certainly do appreciate you. Thanks for hanging out today.
Absolutely.
All right. We'll see you next time. Guys, we will see you next time. You name it, we explain it.
Don't go away.